Doctor, give me the news. I've got a bad case of loving you. This week, we're taking a deep dive into the practice of medicine. As our cover on Medical Guesswork says, from heart surgery to prostate care, the health industry knows little about which treatments really work. We reveal this surprising fact through the provocative tale of a heart surgeon turned mathematician and healthcare economist, a brilliant maverick named Dr. David Eddy. As a medical resident at Stanford in the late 1970s, Eddy began to ask a simple question. Was there actual evidence to back up what doctors were doing? Everything from deciding whether to do surgery or use combinations of drugs to treat an ailment. The answer was, surprisingly, no. Since then, he's proved over and over again that doctors' judgment is no match for the complexities of medicine. Our story looks at a number of examples where evidence is clearly lacking. But there's some good news, too. New approaches for figuring out what works best and for getting better information to patients. That's both improving care and saving money. We'll be back in a moment with senior correspondent John Carey, the author of this week's cover story.
Sharing is good. That's the philosophy that has guided Sun since the beginning. We believe sharing creates better ideas that can move business, society, and the world forward. Visit sun.com to learn more.
Welcome, John.
Hi, John.
You're in Bonn, Germany today, aren't you?
I am indeed.
What in the world are you doing out there?
There's a meeting of the United Nations on climate, which I'm sort of pretending to go to.
Ah, well, good reformer that you are. Now, John, I got to tell you, after reading this story, you've made me afraid to go to my doctor. What are you trying to do?
I think that's a good thing if you're a little bit afraid, because it'll make you a better informed patient, perhaps.
Now, I just want to let our audience first off know that you've been writing about medicine for many years, right?
I have indeed.
How long, in fact, has it been?
Well, I've been in this business at various publications for 26 years and at Business Week for 17.
And I can attest to how distinguished a career John has had. He has lots of gray hair. He looks very much a distinguished journalist. And as soon as you see him, you know he speaks with great authority. He actually looks like a surgeon you'd expect to walk out of an operating room in a hospital. Now, John, how did you stumble into this story?
Well, it actually started with a doctor that we ran across in the summer that was arguing that coronary bypass operations were sort of like bloodletting, something that we should have given up a long time ago. And we did a story over the summer just looking at heart operations and showing that they weren't nearly as life-saving as people thought. And then we sort of said, well, how can we do a larger story which looks at not just one procedure or treatment, but all of medicine?
And your story actually suggests that maybe only 1/5 of the medical procedures we undergo are proven to work. That's incredibly shocking. How'd you get the number, and do you really think it's true?
It's a surprising fact, and it's hard to believe, but if you talk to a lot of people that think about this and look at exactly what evidence there is for treatments, whether you can prove that they work or not, that's the conclusion they come to. I was a bit skeptical myself that the number was that low, but if you do a careful look, if you look at all these procedures, if you look at how much we know about the actual sort of clinical studies behind them, it's sort of an inevitable figure.
Now give us a few examples here. Tell us what common treatments are most suspect.
Well, the one I mentioned earlier, heart surgery, where there's coronary bypass surgery and there's angioplasty. And I think most of us, going into these stories, thought that, of course, this is an operation that saves your life and prevents heart attacks and makes you live longer. But it's not true. The evidence actually shows that if you take a potential other path, which would be drugs and lifestyle changes, which, of course, you would do with those other ones as well, the outcomes are no different. There's the same number of heart attacks after surgery, the same amount of survival, and in some cases you might do better without the operations. And that kind of thing you can see over and over with mainly a series of operations, but also a lot of drug treatments as well.
I mean, another example in the story is diabetes. Talk about that.
Diabetes was an interesting one because, clearly diabetes is a problem with blood sugar, and the whole idea was that if you kept blood sugar in check, you could prevent some of these terrible complications, the strokes, the heart attacks, the lack of circulation that leads to foot ulcers and amputations. But it seems like that a more effective approach is just to try to treat those complications and don't put maybe quite as much effort into managing blood sugar. It's sort of counterintuitive, but it does seem to work.
Now, surely there are many things that clearly work, right? Lowering cholesterol, using antibiotics.
Yeah, I mean, clearly there's a lot of stuff in medicine that have been wonderful boons to mankind. I mean, especially things of antibiotics and vaccines, which have wiped a lot of infectious diseases off the face of the earth and enabled us to cope with the ones that we still have. And cholesterol lowering is another good one, lowering blood pressure. All of those things are shown to improve quality of life, improve survival, and that sort of thing. We also talk a little bit in the story about the additional surprising and startling fact of the things that we know work. A lot of those things aren't getting to the people that need them. It's an additional point to the story that we make in a sidebar.
Now, if the evidence is truly lacking that a given treatment works, how come so many doctors so commonly believe that these treatments do, and they'll open up your chest and operate on your heart, or they'll do the angioplasty, or they'll do this or that? Why has the medical establishment not sort of woken up to these realities?
Well, I think there are two sides to that question. One is that much of the medical establishment, in fact, has woken up to this. The story that we tell in our cover article is how the climate has shifted from sort of denying the fact that we don't have evidence to accepting the fact that we don't have evidence and then figuring out what to do about it. But in something like heart surgery, a lot of doctors think, well, if you have narrowing arteries, it's like plumbing. If you take out the obstruction, then you're obviously going to do better. But it turns out biology is more complicated than that, and so that the simple plumbing model doesn't fit. I think a lot of doctors have this intuitive sense that certain things must happen, but we have one good quote in the story about how a lot of times our intuition, as much as we fervently believe in it, just turns out not to be true.
I mean, the other thing I think that you raised in the story is lag time. And actually, cholesterol-lowering drugs is a good example. Before there were drugs that were actually proven to reverse damage, it was more commonly accepted then, right, to crack you open and deal with it that way, because we didn't know that, in fact, there were drugs available that could reverse clogging of the arteries.
Yeah, this is true. I mean, a lot of the alternatives have gotten better, and so that changes the whole balance of the equation and the risk and benefits of each approach.
Now, much of the story is built around a lone crusader, Dr. David Eddy. Tell us a little about him.
Yeah, a very interesting guy, and we actually were having difficulties trying to shape the story and get our arms around something this big. And over the weeks, I was doing a lot of interviews, and someone at the Kaiser Permanente Care Management Institute, which thinks about these kinds of issues, said, by the way, there's this guy named Dr. Eddy who's doing this interesting work and has spent his whole career exposing the fact that there's so little evidence for things and trying to figure out how to do with it. So we contacted him, and he turned out to be a very interesting person and certainly worthy of wrapping a story around.
How did Eddy get involved in this?
He was one of these sort of overachieving students, went to medical school, came from a long family of doctors, and was a medical resident at Stanford when he sort of started to look around and say, well, why are we doing what we're doing? Why are we putting this patient in intensive care, and why are we giving this patient an IV, and why are we doing this operation? And he was sort of startled and surprised when the answer was, well, that's the way we always do it, and that's the way, we think it works, and that there was no real evidence to back it up. And he also, at the same time, became sort of enamored of the possibility that mathematics could help bring some more logic and rationality to this whole question. And so sort of took a different path and went down this path of being able to try to understand the sort of the logical and rational basis of medicine rather than following the path he had been on.
Now, you went out to Aspen to visit him. What was that like?
It was a very interesting visit. Before I came, he had said, bring some walking shoes so that we can take a walk. And when I arrived at the door, he apparently realized when he looked at me that I might actually be able to keep up with him because he's a tall, athletic, and a mountain climbing guy, even at age 64. And he has this beautiful place in Aspen and an office filled with high-end audio gear. And it's a great work environment. He can just go skiing right out this back door. And we sat around in his house and office for a while, and then we took a walk up a mountain and discovered how competitive both of us were.
How smart is he?
He's a very smart guy. I mean,